a rehabilitation center opened in a suburban community. The facility promised hope for families devastated by addiction, state-of-the-art treatment programs, compassionate care, evidence-based recovery methods. Within 4 years, the organization expanded to 89 facilities across 22 states. Insurance companies approved treatment. Courts mandated attendance. Families paid out of pocket when insurance wouldn't cover the costs. But federal investigators discovered the centers weren't helping patients recover. They were systematically supplying them with synthetic opioids that would keep them addicted for years. And 12,000 people were trapped in a cycle of dependence that was about to turn deadly. This is the story of how trusted addiction treatment became one of the largest drug distribution operations in modern history. Welcome to FBI Focus, where hidden threats meet federal justice. The organization called itself Recovery Path Solutions. Founded in 2018, it entered the addiction treatment industry during a national crisis. Opioid overdose deaths were reaching record levels. Communities were desperate for treatment options. Recovery Path positioned itself as an innovative solution. They promised comprehensive care that addressed the root causes of addiction. The marketing emphasized medical expertise, therapeutic support, and long-term success rates that exceeded industry standards. The first facility opened in Ohio, a state devastated by the opioid epidemic. Local officials celebrated its arrival. Traditional treatment centers had long waiting lists and limited capacity. Recovery Path offered immediate admission. They accepted most insurance plans and offered payment plans for uninsured patients. The facility looked professional in every respect. Licensed medical staff, accredited programs, comfortable accommodations. Families touring the center saw exactly what they hoped to see. A place where their loved ones could finally get help. The treatment model seemed progressive. Recovery Path emphasized medication-assisted treatment combined with therapy and life skills training. Patients received prescription medications to manage withdrawal symptoms and reduce cravings. The medications were presented as FDA-approved tools for opioid addiction recovery. Buprenorphine, methadone, and other substances that had legitimate medical uses. What patients and families didn't know was that the medications being dispensed weren't what the prescriptions claimed. They were laced with synthetic opioids designed to maintain and deepen addiction rather than treat it. Before we continue, let me ask you something. How many people do you think entered these treatment centers seeking recovery over 4 years? Drop your guess in the comments. The real number will devastate you. The expansion accelerated rapidly. By 2020, Recovery Path operated facilities in 14 states. Each new center followed the same model: professional branding, community partnerships, insurance contracts. The organization marketed itself aggressively to families in crisis. Television commercials featured emotional testimonials from supposed success stories. Online advertising targeted people searching for addiction treatment. The company's website displayed accreditation logos and success statistics that appeared impressive. Everything suggested a legitimate, effective treatment organization. Behind the professional facade, something very different was happening. The medications being dispensed to patients contained controlled amounts of fentanyl and synthetic opioid analogs. These substances are exponentially more powerful than traditional opioids. A dose that would normally help manage withdrawal symptoms was instead designed to maintain physical dependence. Patients believed they were receiving evidence-based treatment. In reality, they were being systematically addicted to substances more dangerous than what brought them to treatment in the first place. The Drug Enforcement Administration received its first suspicious activity report in early 2020. A pharmacy in Pennsylvania noticed unusual prescription patterns from a recovery path facility. The volume of buprenorphine prescriptions seemed excessive for the facility's stated patient capacity. The DEA reviewed the facility's registration and found no obvious violations. The case was noted but not prioritized. The agency was overwhelmed with opioid-related investigations. This particular red flag got lost in the noise. 6 months later, another report emerged. A patient who had completed treatment at a recovery path facility died from an overdose. The toxicology report showed fentanyl and several synthetic opioid analogs in his system. His family was devastated. He had been clean for 60 days according to the treatment center's discharge summary. The medical examiner's report suggested recent drug use, but the family insisted he had been committed to recovery. The case was classified as a tragic relapse. No one connected it to the treatment center itself. What investigators would eventually discover was far more sinister than anyone imagined. The breakthrough came from an unexpected source. A nurse working at a recovery path facility in Michigan contacted the FBI in January 2022. She had been employed there for 8 months. What she described was systematic criminal activity disguised as medical treatment. Medications being tampered with before distribution to patients, instructions to falsify medical records, pressure to keep patients in treatment far longer than medically necessary, and, most disturbing, awareness among senior staff that patients were becoming more addicted rather than recovering. The nurse provided specific documentation: photographs of medication bottles with tampered seals, copies of internal emails discussing retention rates and compliance enhancement, records showing patients who remained in treatment for 12 to 18 months when 90-day programs were standard, patient files documenting increasing dependent symptoms while official progress reports claimed successful recovery. The evidence was detailed and deeply troubling. The FBI opened an investigation immediately. Federal agents began surveillance on multiple recovery path facilities simultaneously. The pattern was consistent across locations. Medications arrived from a central pharmacy operated by Recovery Path itself. The pharmacy was licensed and appeared legitimate. But laboratory analysis of medications seized during surveillance showed they had been adulterated. Prescription medications that should have contained standard doses of FDA-approved substances instead contained carefully calculated amounts of fentanyl and synthetic opioids. Stay with me. What we're about to reveal about the scale of this operation will shock you. The FBI coordinated with the DEA's Diversion Control Division. Together, they traced the supply chain back to its source. Recovery Path had established its own pharmaceutical operation under a separate corporate entity. The pharmacy was licensed in Delaware and distributed medications to all Recovery Path facilities. On paper, everything appeared legitimate. But chemical analysis revealed a sophisticated drug manufacturing operation hidden within what looked like a standard pharmaceutical distribution company. The pharmacy was producing medications that contained controlled amounts of illicit substances. The doses were calculated to avoid immediate overdoses while ensuring continued physical dependence. Patients taking these medications would experience relief from withdrawal symptoms, but they would never actually detoxify. Their bodies were receiving regular doses of powerful synthetic opioids disguised as treatment medications. The longer they remained in treatment, the more dependent they became. And when they eventually left treatment, their addiction was worse than when they arrived. Forensic accountants analyzed Recovery Path's financial structure. The numbers revealed a business model built entirely on keeping patients addicted and in treatment. The average patient stayed in recovery path facilities for 14 months. Industry standards suggest 60 to 90 days for most residential treatment programs. The extended stays generated enormous revenue. Insurance companies were billed monthly. Families paid ongoing fees. Government programs covered treatment costs for court-mandated patients. Over 4 years, Recovery Path had generated $1.6 billion revenue from treatment that wasn't actually treating anyone. The patient retention strategy was deliberate and calculated. Internal documents showed executives discussing how to maximize the length of stay for each patient. They analyzed insurance coverage limits and structured treatment plans to extract maximum reimbursement. When insurance ran out, they pressured families to pay out of pocket using financing plans. When patients couldn't pay anymore, they were gradually reduced to lower doses of the adulterated medications, ensuring withdrawal symptoms that would often lead to relapse and readmission. The entire operation was designed to create a permanent cycle of treatment, relapse, and readmission. Here's a question for you. How much more addictive is fentanyl compared to heroin? A. 2 to 5 times. B. 10, 20 times. C. 50, 100 times. Or D. Over 100 times. Think about it while I continue. The answer explains why this operation was so dangerous. The investigation revealed something even more disturbing. Recovery Path was tracking patients after they completed treatment. Former patients who overdosed or sought treatment elsewhere were identified and targeted with marketing to return. The company maintained a database of over 34,000 people who had been through their facilities. When someone died from an overdose, their family members received targeted advertising for Recovery Path services. The organization was essentially farming addiction, ensuring a continuous supply of patients who would need ongoing treatment that would never actually help them recover. DEA agents documented the pharmaceutical operation in detail. The central pharmacy was located in Delaware, operating in a facility that appeared entirely legitimate. Licensed pharmacists worked there. The building had proper security and record-keeping systems. But in a secure area accessible only to senior management, investigators found the manufacturing operation. Industrial mixers combined pharmaceutical-grade medications with synthetic opioids sourced from Chinese suppliers. The mixing ratios were precisely calculated to maintain addiction while avoiding overdose death. The suppliers in China were part of an international network. Chemical precursors were legally purchased as research materials. These precursors were then synthesized into fentanyl analogs and shipped to the United States, labeled as pharmaceutical ingredients. The substances passed through customs because the paperwork appeared legitimate. Once in Delaware, the chemicals were incorporated into medications that would be distributed to 89 facilities across 22 states. The supply chain was sophisticated and designed to avoid. Federal prosecutors convened a grand jury in March 2022. The evidence presented was overwhelming. Thousands of pages of patient records showing systematic harm, laboratory reports proving medication adulteration, financial documents revealing the profit motive, testimony from the whistleblower nurse and other staff members who had realized what was happening. The grand jury returned indictments against 31 defendants, including all 7 executives, the pharmacy director, facility medical directors, and key operational staff. But here's what made this case a race against time. The investigation revealed an immediate threat to patient safety. Chemical analysis of the adulterated medications showed increasing fentanyl concentrations over time. Recovery Path had been gradually strengthening the doses to maintain effectiveness as patients developed tolerance. The most recent batches contained fentanyl levels that created serious overdose risk if patients took doses as prescribed. DEA scientists calculated that over 2,800 patients currently in recovery path facilities were taking medications that could be lethal if combined with any additional opioid exposure. If these patients used any street drugs while in treatment, the combination would likely be fatal. The FBI faced an unprecedented public health emergency. They needed to raid all 89 facilities simultaneously, secure the adulterated medications, and get patients into legitimate medical care. But they couldn't simply shut down the facilities without causing mass withdrawal symptoms that could also be deadly. The operation required coordination with state health departments, emergency medical services, and legitimate addiction treatment providers who could accept transfers of over 12,000 patients currently in recovery path care. The planning took 6 days. Federal agents worked with health officials in 22 states to prepare for the largest addiction treatment intervention in history. Legitimate treatment facilities agreed to accept patient transfers. Medical teams prepared to assess each patient's condition and provide appropriate care. Prosecutors obtained sealed warrants that would allow simultaneous action across all facilities. The operation had to work perfectly. Any delay or leak could result in mass casualties. This raises a critical question. When treatment providers betray patient trust, how does that affect people's willingness to seek help for addiction? Share your thoughts in the comments. March 23, 2022, 6 a.m. Eastern Time. Federal agents executed search warrants at all 89 recovery path facilities simultaneously. The coordination involved FBI field offices from 22 states, DEA agents, state health inspectors, and over 600 law enforcement and medical personnel. Every location was secured within 2 hours. Executives were arrested at their homes. The Central Pharmacy in Delaware was shut down immediately. All adulterated medications were seized and secured as evidence. At the facilities, medical teams began emergency assessments. Every patient was evaluated for their current medical condition and risk level. The adulterated medications were replaced with legitimate treatment medications. Patients were informed about what had been done to them. Many reacted with shock and anger. They had trusted these facilities to help them recover. Instead, they had been systematically poisoned and kept addicted for profit. The betrayal was devastating. The medical intervention prevented catastrophe. Over 340 patients were assessed as being at immediate risk of overdose from the fentanyl-laced medications. If the FBI had waited even one more week, chemical analysis suggested multiple fatalities were likely. Emergency medical teams stabilized high-risk patients and transferred them to hospitals. The operation saved lives that would have been lost to overdoses disguised as treatment complications. Public health officials began the massive task of locating former patients. The 34,000 people who had been through recovery path facilities over 4 years needed to be notified. Many had been given adulterated medications during their treatment. They needed to understand their current risk and have access to legitimate treatment options. State health departments launched notification campaigns. Many former patients learned for the first time that their treatment had been fraudulent and potentially harmful. Consider this for a moment. You seek help for addiction. You trust medical professionals. They systematically addict you to more dangerous substances while charging you for treatment. How would that change your ability to trust again? The trial began in November 2022. Federal prosecutors presented evidence over 7 weeks. Testimony from the whistleblower nurse who triggered the investigation. Medical experts explaining how the adulterated medications harmed patients. Financial analysts documenting the $1.6 billion fraud. Former patients describing their experiences in recovery path facilities. DEA chemists presenting laboratory analysis of the seized medications. The evidence was overwhelming and deeply disturbing. The CEO faced 143 counts spanning 4 years of operation. Evidence showed he had personally designed the medication adulteration scheme before opening the first facility. Recovery Path was never intended to be a legitimate treatment provider. It was designed from inception as a drug distribution operation disguised as addiction treatment. The business model depended on keeping patients addicted and in treatment for as long as possible. Court documents revealed he had personally profited by approximately 208. Internal emails showed executives discussing their operation with shocking callousness. They referred to patients as inventory and recurring revenue streams. They celebrated when patients relapsed after leaving treatment because it meant they could be readmitted. They discussed strategies to maximize insurance billings and pressure families to pay out of pocket. The documents revealed complete absence of concern for patient welfare. The only consideration was profit extracted from people desperate for help. Other executives faced similar evidence. The chief medical officer had designed the medication adulteration protocols. He calculated fentanyl doses that would maintain addiction without causing obvious overdoses. He trained facility medical directors to falsify patient records. His medical license was revoked during the trial. The chief operating officer had managed the pharmaceutical operation and supply chain from China. The chief financial officer had designed accounting systems to conceal the fraud from auditors and regulators. The sentences would send a message about exploiting addiction for profit. In February 2023, after 12 days of deliberation, the jury convicted all 31 defendants on all counts. The CEO received a sentence of 45 years in federal prison plus $280 million in restitution. It was one of the harshest sentences ever imposed for healthcare fraud. The judge explicitly stated that betraying patients seeking addiction treatment warranted exceptional punishment. The other executives received sentences ranging from 18 to 35 years. The facility medical directors received sentences from 10 to 25 years and permanent loss of medical licenses. Recovery Path Solutions was dissolved. All assets were seized, including the 89 facilities, the pharmaceutical operation, and offshore accounts. The total seizure exceeded $2.1 billion, including real estate and hidden wealth. These assets would be used to compensate victims and fund legitimate addiction treatment programs. But no amount of money could truly compensate for the harm done to 12,000 people who sought help and were instead systematically poisoned and exploited. The DEA worked with international partners to dismantle the supply chain. Chinese suppliers who provided fentanyl precursors faced charges in their home country. Several were prosecuted under Chinese law. The cooperation demonstrated growing international recognition that synthetic opioids represent a global threat requiring coordinated response. The case became a template for investigating pharmaceutical fraud involving international suppliers. The impact on addiction treatment industry was significant. Federal and state regulators implemented new oversight requirements for medication-assisted treatment programs. Facilities now face regular unannounced inspections. Medications must come from pharmacies that meet strict chain of custody requirements. Laboratory testing verifies that medications contain what prescriptions specify. The regulations aim to prevent any repetition of the Recovery Path operation. For the 12,000 victims who had been patients at Recovery Path facilities, the path forward remains difficult. Many struggle with increased addiction severity after leaving treatment. Some had overdosed and died before the FBI investigation concluded. At least 89 deaths were directly linked to medications received at recovery path facilities. Families who lost loved ones filed wrongful death lawsuits. The civil litigation continues years after the criminal convictions. The psychological harm extends beyond physical addiction. Patients who trusted medical professionals to help them recover had that trust violated in the worst possible way. Many reported difficulty seeking treatment elsewhere because they feared being exploited again. The betrayal damaged their ability to trust any addiction treatment provider. This secondary harm may be the most lasting consequence of recovery paths crimes. When people with addiction lose faith in treatment, they become less likely to seek help. That reluctance can be fatal. This operation prevented overdose deaths that would have resulted from increasingly dangerous medication doses. Dismantled a criminal enterprise operating in 22 states that systematically harmed people seeking help for addiction. It sent clear warning that exploiting vulnerable patients for profit will result in severe federal prosecution. And it revealed how easily medical credentials and professional facilities can conceal operations that cause immense harm when greed replaces ethics. Cases like this demonstrate why federal enforcement in healthcare matters. The patients didn't know they were being harmed. Their families trusted that treatment was legitimate. Without aggressive FBI and DEA intervention, Recovery Path would have continued operating for years. The investigation protected thousands of people seeking help from an organization designed to exploit their desperation. That's the insidious nature of medical fraud. The victims trust their abusers because those abusers wear white coats and display medical credentials. Sometimes the most dangerous operations hide behind the most trusted professions. And sometimes stopping them means racing against time to prevent deaths that would have been blamed on addiction rather than criminal exploitation. Earlier, I asked how much more potent fentanyl is than heroin. The answer is C, 50, 100 times more potent. That's why even small amounts in adulterated medications created such serious overdose risk. The doses Recovery Path was given patients could have been lethal if combined with any additional opioid exposure. How many other treatment providers might be exploiting vulnerable patients? Should healthcare fraud involving addiction treatment carry mandatory life sentences? What safeguards would actually protect people desperate for help? Subscribe to FBI Focus for more untold federal investigations, where hidden threats meet federal justice.